Have you ever pondered about the qualifications of Sam Vaknin in cold therapy? This question is indeed thought-provoking, as it delves into the very essence of trust we place in those who claim to have the skills to help us heal, to guide us through our struggles, and to give us the tools we need to face our inner challenges. So, who is Sam Vaknin, you may ask? If you're not familiar with the name, Sam Vaknin is a figure who has made quite a name for himself in the world of online psychology. However, Vaknin is not a psychotherapist himself. He has no formal training in psychology or medical training. Sam Vaknin, however, is a figure of controversy in this realm. He presents himself as an authority on the subject, someone who can guide individuals through the depths of cold therapy, a modality he has invented to diminish the false self of a narcissist, yet a therapy he himself would not undergo. No wonder, Sam Vaknin himself is not excited about re-traumatization for his own NPD. However, he is happy to suggest it to others who suffer from NPD. The question we're posing today is not about Vaknin's popularity or his charisma. Instead, we are focusing on the question of qualification. Is Sam Vaknin truly qualified to come up with and, yes, administer any kind of therapy for individuals? The answer is no. Qualifications extend beyond mere academic credentials. They encompass comprehensive education and specialized training, which should instill ethical and moral standards that must be upheld. The case of Sam Vaknin exemplifies a serious breach of professional boundaries, transcending a mere oversight. Vaknin operates without a professional license, posing a significant risk, as he would not be subject to license revocation in the event of patient harm. Contrary to claims, cold therapy does exhibit tangible effects. We appreciate that a particular video revealing the nature of cold therapy with Sandy Gonzal-Ansari has been removed. However, it is important to note that we have retained a copy for reference. Join us as we delve into the evidence, not the facade that Sam Vaknin puts forward, but the truth about his qualifications and the danger he poses to patients. While I acknowledge the unique insights Sam Vaknin provides through his online lectures about NPD and BPD, as well as his poetic narrations about his life and narcissistic experiences, there are serious concerns to address beyond this. Sam Vaknin has delved into creating a controversial treatment method that ranges from questionable to outright dangerous. Additionally, his inclination to formulate new diagnoses such as covert borderline, while in a state of grandeur, calls into question the clarity of his thinking and the trustworthiness and safety of his methods. Vaknin recently stated that he has never personally conducted cold therapy on patients, and only licensed therapists can administer it. Please note, this is not true. Previously, he promoted cold therapy through his website, and he has made several video statements claiming that he has administered cold therapy to patients in Central and Eastern Europe. There were patients, he already hurt. So when Vaknin dives into treating patients as a doctor or professor, it is up to you to get educated who you trust your life to. Let's review the video recorded evidence. Each video offers a distinct look at Vaknin's behavior, highlighting his inconsistencies and troubled personality traits. Collectively, these videos establish a pattern that is difficult to overlook. The first video, recorded in an informal setting, depicts Vaknin engaged in a conversation that appears harmless at first glance. Upon closer examination, it becomes apparent that Vaknin has acquired an education from a diploma mill. Rather than pursuing formal education, he sought a quicker route, which reflects his grandiose self-perception. Over the next 15 years, he frequently lamented the lack of recognition for his expertise, despite not holding any formal qualifications. Vaknin did not consider the option of earning a legitimate degree or officially advancing his credentials. Instead, he was focused on financial gain via social media exploitation. Building a dedicated following on YouTube, Vaknin attracted many vulnerable subscribers, many of whom have likely experienced trauma related to narcissistic behavior. Vaknin's success in engaging and influencing his audience indicates he has considerable abilities to manipulate his audience. Like an effective salesperson, he can persuasively repeat the same messages until the audience is convinced. In the second video, Vaknin outlines his approach to cold therapy treatment, detailing the methods and principles he employs. This session provides insight into his therapeutic technique, erasure, and how it is applied in a clinical setting, illustrating the dynamics between therapist and patient within this specific modality. The power dynamic is notably imbalanced. Vaknin explicitly states his desire for the patient to remain silent, or his words "shut up" during the session. This approach might seem normal to those accustomed to abusive dynamics, but it is indeed concerning. Furthermore, Vaknin mentions that he will disregard the patient's input when they are allowed to speak, which is another troubling, unsavory aspect of his interaction style. Overall, the video reveals a disturbing pattern of control and dominance that Vaknin appears to wield over his client-patient. However, if the previous content didn't already raise concerns, the third video, featuring an interview with Sandy Ghazal Ansari, clearly showcases Vaknin's disregard for appropriate boundaries. He outright dismisses cognitive behavioral therapy, CBT, and other trauma treatment methods as insufficient, claiming his approach is the real thing. His alarming statements, "My method is to rape her again, and I will do it again," indicate he is not merely discussing recollection, but is advocating for re-traumatization through physical actions. Even for supporters of Sam Vaknin, these actions should be concerning, not merely for their unconventional approach or boundary violations, but because of the potential harm they inflict on the patient. In the fourth video, Vaknin's self-portrayal reveals his tendency to dismiss the perspectives of others. He positions himself as the perennial victim, demonstrating a hallmark of narcissism by perpetually shirking responsibility. His representation lacks genuineness, suggesting a detachment from his authentic self. Vaknin narrates a scenario where he becomes akin to a ghost, with his actions and even his digital presence disappearing when scrutinized. Basically, he is merely an image characterized by a chaotic array of thoughts and a complete disregard for the well-being of others. In essence, these videos offer a window into Vaknin's practices, revealing patterns of behavior. In these videos, he provides a glimpse into a side of psychology that's often hidden, raising important questions about the boundaries of therapy and the importance of professional conduct and professional training. In conclusion, had Sam Vaknin confined his activities to teaching psychology online and indulging in poetry, his impact could have been neutral or benign. However, his unwarranted foray into roles meant for qualified psychotherapists, along with his breach of ethical treatment norms, represents a significant threat to both society and himself. Although it's unfortunate for Sam Vaknin, the question seems to be more about when than if regarding his situation. Legal protections may not suffice if a patient were to commit suicide due to cold therapy. It's essential to make clear that, despite Vaknin's paranoia and the vehement hate and loyalty of his followers, we are not his adversaries. We hope that he continues to offer valuable contributions and insights into Cluster B personality disorders and wish him the best. For both his own good and the safety of the public, it is essential that he avoids practicing in areas where he does not hold a license.